Hello again. We're on week 2 with landmarks of the cranium. And we're going to start with the frontal bone. The first item is the zygomatic process. Now, process is going to be an extension of a bone, in this case, extension of the frontal bone, approaching another bone, in this case, the zygomatic bone, and we will tag that process just prior to the suture line. This is the zygomatico-frontal suture. So I would tag the process here and ask you to name it. And it's named for the bone it is approaching. So this is the zygomatic process of the frontal bone. It's approaching the zygomatic bone. Next would be the superciliary arches. They are going to be found just underneath the eyebrows. So this region here would be an indication of the superciliary arches. The supraorbital notch or foramen. Now, foramen is generally a round opening, and a notch is just what it implies, as if someone has taken a knife and cut out a notch in that bone. So this one, above the orbit, supraorbital foramen, you see two here, both are circular as opposed to one being sort of notched out, and I don't have one on either of the skulls. But these would be the supraorbital foramina, plural. Then we have the foramen cecum. I'm going to put them in reverse order. As we go around the frontal bone, you see an extension. This is the frontal crest. And usually the frontal crest will lead you down to an opening here called the foramen cecum. So the frontal crest, foramen cecum. Now on the skull part, the cap coming around the frontal bone, you can also see the frontal crest. But this one will not lead to the foramen cecum. Now we're going to take a look at the parietal bone. And with the parietal bone, the first items would be the temporal lines. You can't see them here, but there's a line going upward and one below it. These would represent the temporal line. And of course, you've got superior and inferior temporal lines. You would probably make that distinction when you get into gross anatomy. The sulcus for the middle meningeal arteries, I can show you those in the skull cap. And they sort of look like grooves where fossil impressions of blood vessels occur. Okay? And these, of course, would be the sulcus for the middle meningeal arteries, cymulus vesicles. All right, next would be the fovea granularis. The fovea granularis will look as if someone has taken an ice pick, and see if I have a better skull, and actually punched depressions within the skull cap. Now, the fovea granularis will have different names depending on the atlas in which you are reading. Sometimes they're called the arachnoid fovea or the arachnoid granulation. They're all the same thing, and if you give us the correct name, we, of course, will give you credit for the fovea granularis. Next is the sulcus for superior sagittal sinus. The sulcus will generally start in the region of the frontal bone and continue on to the occipital bone. We have such a groove that overlie or overlays, if you will, the sagittal suture. It starts in the area of the frontal bone, it increases in the parietal bone, and then it decreases again in the occipital bone. But this is a sulcus for the superior sagittal sinus. Now, we're going to look at the temporal bone. And hopefully you remember the shape of the temporal bone. I'll grab the exploding skull just for a moment. And of course, this is the outline of the temporal bone. it's probably very good if, and recommended strongly, if you get an atlas that shows the different bones with different colors, because it gives you a better comprehension of that particular bone versus the surrounding bone. So with the squama portion of the temporal bone, we would designate it either on the outside, that flat region, or we could designate it on the inside of the temporal bone, again being a flat portion, the sides or the floor. Either one would suffice. The Petreus pyramid of the temporal bone would sort of look like a pyramid rising out of the sand. And that structure is extremely hard, which led us to the term Petreus pyramid. Hard like, if you will, pyramid. Now, the next structure is the external auditory or acoustic meatus. It's going to be found on the outside of the temporal bone, the entranceway, exterior entrance to the ear canal. So this is the external auditory / acoustic meatus. The zygomatic process of the zygomatic arch. Okay? Now, there's a very thin suture line, a minor suture, called the zygomatico-temporal suture. And I would tag the process just prior to that suture line is going in the direction of the zygomatic bone. So this would be the zygomatic process of the temporal bone. Now, if I take a portion of the zygomatic bone and a portion of the temporal bone, those two would form the zygomatic arch. So if you see on your sheet the zygomatic process of the zygomatic arch, that's what we are referring to, but the process would be tagged here. Now, next would be the mastoid process, the large structure on the temporal bone that you see here, and the same thing would occur if you're looking at the temporal bone in color. So here's our mastoid process. Now, following the mastoid process, there's a structure that looks like an inverted horn. It's called the styloid process. And that's a very good styloid process for our skulls because a lot of them are sort of broken off. Next is the stylomastoid foramen. So if you go between the mastoid process and the styloid process, you're going to have the stylomastoid foramen. And this little opening you see right in here, stylomastoid foramen. The next structure is the carotid canal. And I will generally have you go to the base of the styloid process, going in the direction of the foramen magnum, and you're going to see a large depression here and one anterior to it. Well, the first large depression should be the jugular foramen, and then the opening in front of it is the opening to the carotid canal. So you make sure you keep those two structures in mind. The greater petrosal foramen and facial hiatus on this skull, this is probably the best example of one. You can see the canal as it goes from the foramen lacerum, we'll talk about that in a little bit, going in the direction of the Petreus pyramid, but it doesn't go too far, probably an inch, if that, and then the nerve goes down into the skull, which actually represents the facial hiatus for that nerve. Continuing on, we have the mandibular fossa, aka glenoid fossa. That's going to be anterior to the external auditory acoustic meatus, and I'm trying to find a good skull to show it to you. This is the entrance to the external auditory acoustic meatus, and just in front of it, where you see this plastic, is the mandibular foramen or glenoid fossa. Okay? Again, the mandibular fossa or glenoid fossa is going to be anterior to the external auditory or acoustic meatus. This is where the head of the mandible goes, and it's going to pivot as we open and close the mandible. Next is the internal auditory acoustic meatus. So what I'm going to do is tilt the skull in your direction. If we go along the Petrius pyramid, there's a ridge here, and if I rappel down that ridge, the first opening is going to be the internal auditory / acoustic meatus. Now, just below that is a pyramidal type structure, which is the opening for the jugular foramen. So you have the internal auditory acoustic meatus on top and the jugular foramen underneath. We're going to take a break.